physical examination of the alimentary system, examination of the groin and external genitalia. So inspect the groins and the external genitalia for any abnormalities. Note any hernia or enlarged lymph nodes in the groin. The patient should then stand for careful inspection. Once more, as some hernias reduce spontaneously when the patient lies supine. So ask the patient to cough while standing and then look for a visible expansal cough impulse over the femoral or the inguinal canals. So if any expansal impulse is present on inspection, then it's likely to be a hernia. So it is moved to whichever side of the patient the lamp is on, and place one hand over the buttocks to support the patient, and the fingers of the other hand placed obliquely over the inguinal canal. So now ask the patient to cough again, and if an expansal impulse is felt, then the lamp must be a hernia. So next, decide whether the hernia is inguinal or femoral. So this is done by determining the relationship of the sac to the pubic tubercle. The tubercle will be felt as a small bony prominence 2 centimeters from the midline to the pubic crest. If the hernial sac passes medial to and above the index finger, placed perpendicularly on the pubic tubercle, then the hernia must be inguinal. But if it is lateral to and also below, then the hernia must be femoral. If it has been decided that the hernia is inguinal, then you need to know further points like what are the contents of the sac. So bowel tends to gurgle and is soft and compressible, whereas omentum feels firmer and is doughy in consistency. So is the hernia fully reducible or not? So ask the patient whether the hernia is reducible, and if so, get him to reduce it. It is more painful if the examiner reduces it while lying down. So is the hernia direct or indirect? Determine this while the patient still lays down. And also place one finger just above the mid inguinal point over the deep inguinal ring, and if the hernia is fully controlled by this finger, then it must be an indirect inguinal hernia. In examining the external genitalia of the male, note any obvious abnormalities of the penis, small size of penis, phimosis, paraphimosis. Also examine the scrotum and testis, the size and consistency. Also the normal adult testes are about 5 centimeters in length and are firm and non-tender. Also small soft testes indicate cirrhosis or hypogonadism, for example in Klinefelter syndrome. And also examine for swellings such as spermatocele, hydrocele, and also varicocele. In examining the external genitalia of the female, note the distribution of pubic hair, obvious abnormalities of the introitus, and enlargement of the clitoris. Extensive distribution of pubic hair over the abdomen, as hirsutism, is associated with alteration in estrogen and androgen balance, for example in polycystic ovarian syndrome, also adrenogenital syndrome. Enlargement of the clitoris suggests androgen excess.